Hey, everybody. Welcome to today's Facebook Live and Autoimmune Table Talk. Today, we're going to be pulling the lid wide open on what I call super infections. There are super infections such as Epstein-Barr virus, Lyme, the big C, which I will not name because I'll get censored, sometimes strep. So there are some infections that I call super infections, and there's a lot of focus around that. I mean, this week in the Facebook group, last week in the Facebook group, if you haven't joined it, join our Facebook group, Transform Autoimmune Disease Naturally. Questions all the time around this, which gets a lot of heat, a lot of love, and a lot of hate under the posts. So today I decided just to meet it head on and just kind of clarify what's the role of super infections have on autoimmune disease. Hey, everybody, welcome to today's live. And I'm Maggie, MD. I'm a functional and holistic medicine physician and the creator of the Transform protocol to transform autoimmune disease naturally. If you haven't joined our Facebook group, make sure you join our Facebook group, Transform Autoimmune Disease Naturally. And and just to give you a little bit of background about me is that I am a functional medicine physician, which means that I am an MD who practiced family medicine for about 12 years before I got really sick with multiple mystery illnesses and symptoms before being finally diagnosed with multiple autoimmune diseases. And now, after all that I've learned that I didn't learn in medical school or in my medical training, after all the years, the last, I would say 12 years, I've learned a ton about the role of natural medicine, alternative medicine that's data driven. And I've combined it with all my MD smarts to basically deliver all these trainings and a Facebook group and help clients turn around any autoimmune disease around naturally. So we do have an online program that's called Transform Autoimmune Disease Naturally. If you're interested in learning more about the program, there's a link above, and we will put a link in the comment section right now for you to start a chat with our team. But today we are talking about super infections. And well, why do I call them super infections? Let's start breaking it down. First of all, for those of you that are joining us, in the comment section right now, tell me where you're watching from and tell me what autoimmune struggles you're struggling with, because here's the deal. I hate to talk at you. I love to talk with you. And I don't know how many times you have a functional physician that actually specializes in autoimmune disease answer your questions live. So if you have questions or comments, put it in the comment section right now. I would love to hear from you. And it really helps me out to want to answer more and more of these questions. Oh my gosh, I love it. Angela's watching from Farmington, New Mexico. I love New Mexico. I love that. Thank you, Angela. Angela says, I've been told I have MCTD. Just so you guys know, I have to speak a little bit about my own history. I have a history of mixed connective tissue disorder, Hashimoto's, fibromyalgia, and I also have thoracic outlet syndrome. So, I mean, you've named it. I have had it. I had early menopause at the age of 36 that my doctor told me I was just getting older. And I'm like, I'm 36, not 86. And guess what it was? My autoimmune disease. So our program focuses huge on hormones, obviously, and any autoimmune disorder. And I had to figure out how to solve this for myself to fight for my own life, right? So there are a lot of different parts of our program. I can call it the 5 pillars protocol. And when you look at the 5 pillars, those are the root causes of what's feeding any autoimmune diseases. And I want to address one of the issues, which is infection. Like, people talk about infection, and a lot of times I find that to be a very confusing topic for doctors and for patients. And in the Facebook group, I can tell you right now, there's a lot of fake experts too. There's a lot of people there's a lot of people who've written books that I, looked at, and I have looked at also the data. And as an autoimmune experts, I have a lot of problems with. And so I got a beef with how some of these infections are being discussed or misunderstood by some of the lay public and even some of the medical professionals. Okay, so let's talk about it. So when I say what are super infections, I'm talking about, people think Epstein-Barr virus, CMV virus, Lyme, the big C. And I would even include strep in there. And so I'm kind of going to go break it down a little bit in general. Okay. In general, do these infections, are they the cause, be all end all of all autoimmune disease? No, they're not. Okay. And there is somebody who wrote a book who said every single autoimmune disease is because of Epstein-Barr virus. They're wrong. It's not true. Okay. However, that being said, there are pieces of this is true, because when I look at these infections, these are super infections, meaning that they trigger a huge immune response in regular people, but in the autoimmune person, sometimes even bigger. And so when you think about it, in our immune system, when your immune system if we have autoimmune disease, it means that our immune system is mistaking our own body as a germ, right? And it's actively trying to kill us when it should be actively trying to kill germs, right? So in general, people with autoimmune disease don't fight infections well. However, that being said, when something is a super infection, it is very triggering. It is very triggering for normal people, but even worse for autoimmunity with a super immune response. So example, when you're talking about EBV, which is Epstein-Barr virus, another common name for it is mono. Why is it that 5 people can have mono and 3 people will have something for a month and 2 people will have something for 6 months and somebody will have no symptoms? It's the difference in individual immune response. And what I've found is that certain type of infections looks very irritating to your immune system. They're like super irritating, and I would say, super allergenic. Example being like certain infections, can some of those cells incorporate into your cells, making your own cells look worse so that your body attacks it more? Yes. That's the kind of mechanism that I'm talking about in autoimmunity. Think about this, okay? Let's say you have autoimmune disease, Hashimoto's. Angela has mixed connective tissue disorder. Virginia says she has Hashimoto's, which is her thyroid right here. I'm seeing in chat right here. Thanks, everybody, for talking about this. And chime in chat. Love to hear from you. So let's say you have any autoimmune disorder, right? I have Hashimoto's. I have mixed connective tissue disorder. But let's say I happen to get mono. If I happen to get mono, maybe my partner gets mono, but he might be sick for a month but maybe 2 or 3 months later, I still have symptoms. Why? Because my immune system isn't set up to fight infection as well, because it's busy hurting my own body. And then on top of it, Epstein-Barr virus, mono, when it infects people, tends to stay in your system for a much longer period of time. Therefore, if it infects some of your cells, it can make your own cells look foreign enough to trigger a worse autoimmune attack. Is this making sense? Because I want to make this super clear and simple for everyone to understand. So certain types of infections incorporate into your body and cells in a way that can make your own cells look even more foreign, triggering a harsher autoimmune attack. Okay. So this is why sometimes somebody will get mono and be sick with it for a long time. Or the other thing is, they may have never had autoimmune disease before, but they'll get Epstein-Barr virus or mono and then suddenly start autoimmune disease because they always had the genetics. But because the Epstein-Barr virus is infecting their cells, now all of a sudden your body says, oh, those cells look even more foreign. I'm going to try to kill them. And it can trigger the onset of autoimmune disease. We know this is one of the mechanisms. And if you look at Lyme, okay, Lyme is a bacterial infection that's triggered by a tick bite. But we know certain types of bacteria infections can incorporate into our cells. The way they infect is they incorporate and they attack our cells. And the way they incorporate in the body can make tons of parts of your body look foreign. So Lyme is a super trigger for autoimmune disease. And we know that because people post-Lyme can have tons of new onset of autoimmune diseases, tons of mystery symptoms all over their body. We know it attacks many places in the body, and it can be a trigger of autoimmune attack. So again, strep is another thing. So if someone, like example is, there's certain kids with strep infection of the throat, okay? And post-strep, they could develop autoimmune diseases like Kawasaki's disease, which is a autoimmune attack against arteries. You could have autoimmune related PANDAS, which is autoimmune attack of different body parts, including brain or neurological symptoms. So we know those are triggered by strep in kids. And now, interestingly, the big C, same thing. This is what we're seeing is that, and I'm using the big C because I can't say that word, okay, or this video will be censored. So when we're talking about the big C, what you're seeing here is that people who have autoimmune disease after that will get a lot worse. Or people who have no autoimmune disease get it, and then they will have new onset of autoimmune diseases. And interestingly, remember I just talked about kids with strep is getting Kawasaki's, which is an autoimmune disease of the arteries. Well, guess what? The big C, or sometimes even certain vaccines, um, can trigger some of this. We've started to see in kids some cardiac issues, even Kawasaki-like syndrome. So what we know is that the way that some of these viral infections attack your body can make your cells look really foreign, and it can trigger the onset of an autoimmune condition like Kawasaki's or PANDAS in children. So I want everybody to understand is that there are one of the root causes for autoimmunity is an infection. Okay, that is possible. Okay, but the problem is, that I think, well, what am I supposed to do about this? That's the problem, is that the concept is correct. Okay. But the focus on it and how we treat it as a medical community is all over the map and is freaking insane. So I can tell you right now is, I'm a functional medicine doctor. I'm a family medicine doc who got sick, who became a functional medicine doctor, and I specialize in autoimmunity. So I see a ton of you, and I've seen a ton of you with these infections or claim to have these infections, or providers who claim you have these infections. And I have also worked with hundreds of providers here in the Portland area, and we've shared plenty of clients. And many of them specialize in dealing with these infections as well. And here's what I learned. I feel like it's a huge injustice to clients, because I wouldn't send most of you to those people, because my experience is that couple things. When you look at Epstein-Barr, when you look at Lyme, like example, testing, conventional testing and non-insurance paid, more accurate testing is really, there's a lot of different ways to test for these infections. And the problem is that there are false positives and false negatives in every testing method. And so you have a lot of practitioners out there that will test everybody, that they'll say, I'm a Lyme specialist, let's say, and everybody comes in and they get the Lyme tests that they like, right? And if you look at the literature, there's still controversy around what's the best test for Lyme, example. And then what happens is, in my experience, every person that goes to this, I'm just going to name practitioner X, someone I know who's a Lyme expert in this area, everybody that goes to his or her clinic comes out positive for Lyme, 100%. How is that possible? It's not. So another one would be, and another one would be somebody who wrote a book that says every single autoimmune disease is caused by Epstein-Barr virus. Well, that isn't true. Okay. It is not true. But when you try to test for Epstein-Barr virus, there's multiple ways to test for Epstein-Barr viruses. So here's the other thing. You go to your doctor and say, I want to be tested for Epstein-Barr virus. Well, listen to this. If you have autoimmune disease, our test, if you ever had mono before, will stay positive almost for the rest of your life, because we have a hyper-triggered immune system. So we can have a false positive to Epstein-Barr for a very long time, sometimes even decades, when you don't have any more active disease. So does everybody have Epstein-Barr? Well, everybody had Epstein-Barr. Everybody had mono at some point, but that doesn't mean they have current active disease. If you don't understand that the autoimmune population are prone to have these tests stay positive for a really long time, and you're not an expert enough to date on what the latest testing methods are, plenty of false calls are being made, and people are being lulled into thinking, I'm going to spend thousands of dollars and years chasing this Lyme, chasing this Epstein-Barr, because it is the cause of all my autoimmune issues. And it's not. Okay. It is one of the triggers, but it's not. It is statistically absolutely impossible that 100% of people going to practitioner X comes out with positive Lyme, because that's not true. Okay. So problem there is problems with testing methods, poorly understood. Also, a lot of experts, every time you go to their office, the method they test or don't test, and they could just feel your woo-woo, however it is. Sometimes you go to at the Lyme clinic, everybody comes out with Lyme. It's the same. I mean, I have a beef with this too. A lot of times, sometimes someone is a heavy metals expert. Everyone coming out of their clinic has heavy metals toxicity. And that's not, it can't be possible. For me, as a scientist, it's really important that one, we have accurate testing, and two, if it's accurate, it will tell you who actually has it and who doesn't have it. And some diseases we have that for and some we don't. And so I'm going to tell you right now is that I actually tell people that it's really important if you think you currently have mono, if you think you currently have a new case of Lyme, do seek help. Do seek help and get accurate testing to see, because the best time to test for an illness is right when you have it. Unfortunately, a year, 2 years down the road, and even 10 years down the road, if you retest it and you have autoimmune disease, there's a higher tendency for you to have a false positive. So you might be mistold that you have an active case right now when you may not. So there's so much intricacies in it that it is very confusing. And I don't blame you if you're confused, because I have to keep up with it all the time. So it really, and what I notice is in our Facebook group is this: be very careful. And I'm saying, especially in other Facebook groups, in our Facebook groups, at least we monitor. We have a whole team working in the Facebook group. We have a whole team of 3 people right now working in the Facebook group to make sure we don't have false information in there. But do you know, every time we have a Lyme post, we have literally 20, 30 fake experts come up saying they know the be all end all. And of course, everything that you have is because of Lyme. Well, if all we have to do is treat Lyme to deal with every single person's autoimmune issues on the planet, that would make life really easy. But it's not true. So I want to be very careful with this, which is that if you have a new onset of symptoms and you're suspicious you have Lyme or Epstein-Barr, by all means, go in and get testing, because testing for acute disease right when you have the symptom, very good, very good. That would be the best thing to do. Now, if you've struggled with Epstein-Barr virus in the past or Lyme in the past, here's what I'm going to tell you is this, is that many people come to our program after decades or years of treating them, and their autoimmunity still isn't better. That's why they end up seeing me. Okay. So if that was such the holy grail, if that's the be all end all and it's the only thing, nobody would need me after treatment for Lyme or Epstein-Barr. But this is the kind of calls we get every single day when we talk to you: is you have Lyme, you have Epstein-Barr, and you think, or your previous practitioner thinks, that's the most important thing. I'm going to tell you it's just one of the things, and it's highly misunderstood. Is this making sense? And let me take a quick look and see if there's any questions here so far. Someone just said, I had mono when I was 14. Yeah, and I bet you that person that has said, I'm just going to show that comment. This person said, I did have mono when I was 14. And I'm going to tell you that one of the things really interesting is that everybody with autoimmune disease who's ever had mono, if you retest yourself right now, you're going to come up with a ton of positives on the mono panels. Okay. And I'm speaking from that from experience. Okay. Claire says, I had strep chronically as a kid, twice or more yearly, lots of antibiotics, diagnosed with the lupus as an adult. So this is an interesting link. And Claire's really, this is a great point, which is that our kids who are having chronic strep infections, they are at higher risk. If there's already a genetic predisposition in the family for autoimmune disease, and then you throw recurrent strep infection on this kid, then the strep incorporates into the body, making it look more foreign. It could literally be the switch that turns on autoimmune disease. So Claire, that's a perfect example of this. So I hope you guys are learning this. We have another alumni. Great. Thank you. Now, I have another question here. Can Epstein-Barr virus reactivate and trigger new autoimmune symptoms? So hot topic, right? So yes, you can get reactivation, but that's not usually the case. Can you get a new infection after having had a previous infection? It's more likely the picture. So that's another subtlety, and it's a great question. So what I have seen is that, let's say I had mono 20 years ago. I did have mono 20 years ago, and my current test is positive. I don't have active mono. Okay. But let's say I suddenly get mono again. Okay. And I currently have symptoms of mono, and I do the test or multiple different types of testing, and it shows that I have mono again, a new set of mono again, not just old chronic mono, but a new mono. Can I have new autoimmune symptoms get triggered as a result of this new reinfection with Epstein-Barr virus? The answer is yes, yes, and hell yes. Because like I said, Epstein-Barr virus is a super infection. So the question then becomes, people will be asking would be, well, do I need to go find an expert on Epstein-Barr virus, Lyme, or strep and go that route? And I would say if you currently have an active infection, that's a good route. If you have had a history of that infection, that would be a bad route. And from personal experience and from seeing tons of people go through this, when you have had a history of that and you go into an expert, you could be diagnosed or misdiagnosed with a continuous current infection when in fact you may not. And then the problem is that you will also have to go through thousands of dollars, months, maybe years of expensive treatment, IV, supplementation, office visits to deal with something. And yet people don't get better. And some people do, most people don't. So I'm at the other end of this, where after everybody has spent all that money, time, and energy with other practitioners dealing with these infections, they're still sick, new autoimmune symptoms, new autoimmune diagnosis, they need my help. And so I think for me, I have a really important point and message here, which is that infection really is important as a consideration and one of the feeders. But the order with which we approach infection first is wrong. I'm going to make this point again, and I'm going to hope you guys can understand why I'm saying it. The order with which we attack infection in those with autoimmune is wrong. And I'm going to give you plenty of examples. So let me give you an example. How many of you have SIBO? How many of you have Candida? How many of you had it over and over and over and over again? Okay. And yet when you go see a naturopath or functional doctor, that's usually one of the first tests that's done. And that's usually the first focus. And I think I know the order is wrong, because here's why. When you look at the 5 pillars of transform, right? I think about it this way. You go and try it. Let's say you go see a naturopath, a functional doctor. You said, oh, you have SIBO. They kill it. And then it comes back over and over again. Years and years of this, cycles and cycles of this. How many of you have had that? Well, only to find out they still have it, keeps recolonizing, and the autoimmunity is no better or even worse. This is the common scenario of most people that are joining our programs. And it's not that approaching infection is a bad idea. It's that there are things that you need to do first before you're able to effectively address infection and to prevent recurrence. And that's the 5 pillars. So give you an example, which is one of the pillars is blood sugar mastery, which means you're preventing high and low blood sugar. And here's the deal. Every time you reach high blood sugar, you're feeding the infection. Every time you drop from high to low blood sugar, you're feeding the autoimmune attack back and forth all day long. So if you don't have blood sugar mastery, it doesn't matter what IV or what supplement you're using to kill that infection, it ain't going away and it's coming back over and over again. Secondly, a lot of these infections live in the gut and they love a broken gut. That's a war zone. So, example, if you have a Candida infection in your gut, how many of you had it come back over and over again? Because the environment is what the Candida loves. So what are we doing to change that environment before you could even attack the infection so it never comes back? Food mapping, digestion. These are pieces of our pillars. So if you don't know which foods is triggering the autoimmune attack and you're constantly eating it and it's a war zone in your gut, Candida is going to keep coming back, my friend. It's going to keep coming back. If you don't understand the role of digestion as the first line of defense against infection, which no functional doctor is discussing in autoimmunity. Nobody's teaching people about the role of digestion, which we do in our program. Okay. And if you're an alumni watching, how much has digestion really improved your autoimmune disease? Right. So here's the thing. If you're not properly digesting, the food is fighting your gut to get broken down and absorbed. It's a war zone. So guess what? Infections come back over and over again. So for me, it's really important to do the work to actually clean up the environment that's in your gut by no longer eating the allergens, by having blood sugar mastery, by having optimal digestion. That way, guess what? There's nothing good for Candida to come back to. There's no cheese up that tube. Candida can't come back to an environment that's healthy and thriving. It loves a war zone. So this is a lot of topic and discussion around super infections, but also other what I call opportunistic infections. And I think it's really important to take a perspective of, making sure that if you had a history of infection, don't jump to that first right now as what you should be dealing with. Okay, that should be last. What you should do first is clean up the environment by working on food mapping, blood sugar mastery, as well as digestion. that's going to optimize the environment, making it impossible for some of these organisms to come back. So I tell everybody that our program is naturally anti-infection because every week over the course of 2 months, you're actually going to be fighting infection. Because what does it take to fight infection? Removing the food allergens, better digestion, better hydration, removing the food allergens, right? Balancing your blood sugar, right? So every week, our clients in our program are seeing less and less symptoms of autoimmunity. And at the same time, they're lowering and lowering their infection load. So this is really something important to understand. So that order is really important. And I see people looking at the pyramid, like let's say at the top of this pyramid, the goal of this pyramid is to kill an infection. Well, they're just focusing on this tip of the pyramid and they keep knocking on the tip of this pyramid for months, years, or decades, when really the bottom work layers is what's needed to get to the point where you can say, oh, do I even need to address infection anymore? That's the beauty of this. Okay. Let me take a quick look. Let's see, alumni from the program, stomach, brain fog, etc. Dr. Maggie helped me so much this program work. Oh, thank you. That's Regina. Thank you, Regina. And then Dana says, do you think IVIG can help reset your immune system after being triggered by serious past infections such as Lyme, EBV, or SIBO? Again, I think, Dana, I just addressed this, which is that, again, that's just another Band-Aid. Temporarily giving antibodies doesn't resolve the issue that the environment in your gut is basically a party platter for all these infections. So people could be like, can this supplement help with this infection? Can this help with that? Can antibiotics help with this? Well, yeah, of course. Any of these things can help decrease amount of infection that you have. But the problem is they keeps coming back. So it's like a gravy train that recycles itself. I tell people that when I had a clinic practice, that one of the things that I would address with people was the role of infection, right? But the problem was in the clinic setting, people kept coming back over and over again. We got rid of the infection; it would still keep coming back over and over again. I was working with people on SIBO, Epstein Barr virus, with Lyme, all that, but it kept recurring over and over again. This is also why this program was born, because I finally recognized, which is I'm just doing a recycling system with people, and how can I break the cycle? Oh, we need to change the environment in the gut that is causing the autoimmune disease and the infection to be there in the first place, which is why multiple pillars in our program address these points. Now, if this is making sense with you and you're like, what the heck are the 5 pillars? I want you to type in the comment section 5 pillars, because you got to watch what the 5 pillars are that are triggering autoimmune disease. What I want to do is bring my 26 years of experience dealing with my own autoimmune disease and thousands of people's of autoimmune disease to just tell you what my experience is and what I know to be true, which is not only is the content of what you do for your autoimmune disease matter, but the order really matters. If you don't have the right content of what to do, and then you don't do it in the right order, you're spinning your wheels, wasting a lot of time, money, and opportunity. And meanwhile, autoimmune disease doesn't have a stop button. It's continuing to cause more and more and more permanent damage, right? So it's really important to not hyper focus on something that should happen at the end, which is where am I with infection? And focus on what are the order of the right things that I need to do in the first place. Order really matters, and I address it in the 5 pillars. So if you want to watch the 5 pillars, write 5 pillars in the comments. A member of our team will send a message to you, and check your message request box, because a lot of you guys are not seeing the messages we're sending. You ask for resources, we send it to you, but you don't realize it's in your messenger message request box. If you can go take a look at that, that would make a big difference. But yeah, Dana, a lot of things can be helpful for infection, but the true matter is, what's the right order? You may never need that. And the question really is, how do we prevent recurrence of these infections over and over again? Angela says, this is making sense. Thank you so much. Kelly says, Maggie, yeah, your program has been the answer to my prayers and is taking all the guesswork out of what I need to do to solve my autoimmune issues. So much misinformation out there. Yeah. And thank you, Kelly. I really appreciate that. It is not an easy subject to really explain. Lyme, Epstein Barr, the big C, or strep. This is a ginormous topic, but I really want to address it head on, because it makes me kind of sick when I see a post in the Facebook group, someone said, "Oh, I had a history of Lyme and now I have colitis, looking for advice." And then you have 10 people underneath and says, "Oh, it's Lyme and you need to get this test from this lab and this is what you need to do and this is who you need to go see." Yeah, I really, it's tough for me to see people give misinformation like that. Maybe that was your experience, but you sure as heck shouldn't be giving someone else advice like that when you don't know anything about them. And I do actually deal with Lyme and Epstein Barr and the big C, and I understand all these pieces. I would never give information like that or advice like that over the internet. It's unsafe, it's dangerous. And out of respect for all of you, I would rather spend the time head on right now up front, just educating you guys all about the intricacies of it to know that it is the wild, wild west out there. So let's see. We got alumni. Love the never ending information. I love that. Thank you, you guys. Dara, another alumni. So true. So true. Dr. Maggie set me up for success after history of Epstein-Barr virus, strep, and Lyme, and I got so much food back into my diet. So that's an interesting point, right? Here's a perfect example of someone in our client who went through our program. And you're not a super special zebra. Most of us with autoimmune disease have had a history of Lyme, strep, or Epstein-Barr, or some other infection, right? This isn't special or rare. What's unique is that the commonality is you guys come to me with this history, and I'm like, yeah, I understand. This is what I hear every single day. And that's not what you're going to be addressing first at all. Here's the right order to do it. So I love the fact that, I think proof is in the pudding. We have somebody who has that exact history, and they did food mapping in our program, probably was eliminating a lot of food and was able to reintroduce a ton back of food. Remember, making a healthy environment in your gut doesn't mean removing, doesn't mean another elimination diet. Food mapping in our program uses your blood test to identify exactly the foods that you should remove, but also all the foods you should put back in. And most of the people in our programs are adding more foods back in, not removing a ton, just so you guys know. So I love that. Reggie says, alumni here, digestion food mapping was huge for addressing my problems. Thank you, Reggie. I really appreciate that. Tracy Kruger in our program right now. I am now an alumni. I always learn so much from Dr. Maggie and love to keep learning. Thank you, Tracy. I love that. Let's see, Charla. If your liver is not fatigued, it can do its job. Yep. So much of what we're talking about in the program is also liver support, Charla. You know it. Oh, this is a good question. Is food mapping the same as food sensitivity testing? Hell no. What part of hell no did you not understand? There is a complete difference between food mapping, which is what we do, and what you're getting out there as food sensitivity testing. That's a huge topic. I did a bunch of lives. I even did a smackdown between elimination diet versus food mapping. So if you actually want to access the full trainings I did around how food mapping and food sensitivities is different, that's also in our 5 pillars training, but I did some separate trainings around food mapping. I also did a training around food mapping versus elimination diet. If you want more information on food mapping, type in chat right now. And I'll also put a link where you can start a chat message with our team. So I'm going to have our team put a link so you don't have to look for your messages. Just click that link and start a message and say you want food mapping information. Food mapping is a process I created. So people who tell me I've done food mapping before don't know what the heck they're talking about because I created the process. So I created food mapping from literally over a decade of food health in myself and working with clients and doing hundreds and hundreds of food sensitivity testing and having huge problems with the tests and provider understanding of these test results. So I can tell you in one word that food mapping is the opposite of elimination diets. Food mapping is also a blood test using your own data. Yes, it is a food sensitivity test per se, but it is the best test in the last 15 years that I've done after doing hundreds. And here's the deal. People with autoimmune disease, even with the right test, have tons of false positives and negatives. So unless you are trained exactly how to understand those results, it can be useless. So there's a whole process around right test, right education, right mentorship and training to make sure you know exactly which foods are accurately you need to remove and which to reintroduce back. Big difference. Not a not just a meal or let's go do a food sensitivity test. No, it is a whole process, and it is supported by a functional nutritionist in our program. So if you want more information about that, just type it in chat. Would love to have our team provide you with more information. And tons of you are asking for 5 pillars. I love it. And food mapping. Oh, I love this. Someone said food mapping was a game changer for me. I would love if food mapping was a game changer for you and you're an alumni in the program. Can you tell people in chat how food mapping was a game changer for you? What did you learn from it, and how was it like? Because I'll tell you right now, people who go through our program know that they've been through food sensitivity testing and elimination diets before that didn't work. So I'm here to not repeat SHIT that doesn't work. Okay, I'm only here to teach and do stuff that works. So that's what food mapping is. And no, you haven't done food mapping before, because I created the process and the term for it, and it's very unique to our program. I hope that was super helpful. All right, everybody. I think that's a wrap. Now, here's the thing. A couple things. Everybody that commented here, okay? Everybody that commented here today in today's comment section, later on today, check your message requests. There's probably going to be some questions from our team and some resources that are going to be shared with you. We're also putting a link here. If you want to chat with us, go ahead and just click that link and chat with our team. We have someone who's ready to chat with you about any questions you have about the live I just gave, or any information about our program. I love that. Misty just said food mapping. Would like food mapping information. I love that. No problem. All of you that are asking for food mapping information, 5 pillars information, you can either start a chat with our team, or you can check your message requests. By the way, I am really thankful today because I love to come on live every Thursday, but I can tell you something. It is not fun for me to talk at people. I don't like it. Like, I am an extrovert and I thrive off of I truly love and appreciate the community we have on YouTube, on Facebook, and on Instagram. And what I love most is the interaction I have with you guys. So for me, today's live was a big win for me because you guys are actually talking. And I really appreciate when you guys talk and come back with questions and feedback. And we have so many people who've been through our programs who are able to share their experiences right here live. Reggie just said, alumni, found through food mapping that things I was eating on a daily basis was causing havoc on my body. Eliminated them and feel so much better. I know. And I wouldn't be surprised if Reggie has done food sensitivity testing before with other practitioners and had not had good outcomes, because that's the typical client that comes through our program. I love that. Stacia says, food mapping was key for me. It took all the guesswork on why I felt sick with different foods and rashes I would get months later. That's awesome, Stacia. Great. All right, everybody. That's a wrap. And if you guys enjoy these lives, please come keep the comments going. Even after this live, if you have additional questions, go ahead and type it underneath this video. I promise you, every question that you put into chat within the next 24 hours, I will look at personally, and I'll try to give you a response right there in the Facebook group. So if you're in the Facebook group, if you're not in the Facebook group, click the link and join the Facebook group. If you are in the Facebook group, every comment that's a question underneath here, I will take a look at this in 24 hours and I will personally look at it and answer. And that's a deal. All right, everybody, have a wonderful day.